And today we'll start our journey with learning the pulmonary embolism. Okay, pulmonary embolism management, very important this issue. Now how we will manage it? I'm going straight to its management. Number one, we should go for learning about general management. In general management, what you should do, you should give in such patient, they are usually hypoxemic, there is hypoxia, so you have to give oxygen to these patients. He may have or she may have suffering from chest pain, you have to give opioids, okay, like Pathidine, morphine, etc. as needed. So these two is very much important for management of the hypoxia and management of the pain, right? Next, it is all about anticoagulation. It is the main issue. There will be coagulable state, there is an embolism due to hypercoagulation. Now you will give an anticoagulation. How will manage it? Let's start. In anticoagulation, you can give the drug management. Different kinds of drugs are there, but most importantly, you should anticoagulant drug. Keep in mind about low molecular weight heparin, like enoxaparin, and another one is the warfarin. You will start those two drugs simultaneously. Okay, after using these drugs, it is being told that there is timing of using those drugs, and I am giving you the timing. You should use this warfarin for at least 5 days. You have to go for more, but for at least 5 days you have to go with alongside warfarin. You have to give the low molecular weight heparin, and you target INR, and you will follow up the INR, and your target INR would be, there will be always a target in management. So it is 2.5 or range 2 to 3, and you can only stop low molecular weight heparin if INR is more than 2. Then you can continue with that warfarin. Okay, now there is another option of drug, second option is there. Second option, you can use DOACs, direct oral anticoagulants, okay, and some of the example are that, like Rivarox, Zaban, Epix, Zaban, Dabigatran, Edoxaban. There are several medication. So in these drug, especially that DOACs, you don't need low molecular weight support. You don't need that, okay, except you should keep in mind two other drugs. There's a DOAC, but you need low molecular weight support. That is the Dabigatran and Edoxaban. Okay, so what is the useful? These are usually oral and easier to use. You don't need to monitor that INR monitor that was necessary here, but it is not necessary here. Okay, so that's why in DOACs option like Rivarox and Epixabin, where you don't need low molecular weight heparin support also, so that's good option. Okay, but if it is this pulmonary embolism or venous thromboembolism is related to cancer, then it is always low molecular weight heparin is preferred. Okay. Now how much you should use? Normally it is been told that it is duration of your treatment, duration 6 week to 6 month. But for provoked one, you know the cause of this embolism or thromboembolism, you should go for 3 months treatment. Okay, but in case of unprovoked or you don't know, you can go up to 6 months. And if there is any risk factor like cancer, you can go this treatment, it can be long term treatment, not specific to any timeline. And there may be needed to cope up with or treatment of those provoking causes like cancer. Okay, now if there is a DVT, you have pulmonary embolism and you are also suspecting the patient has DVT, so what will you do? In DVT you give specific limb treatment, limb elevation, you give pain for analgesia for pain, and same anticoagulation as I mentioned above. And if that is life threatening, then you may have to go for thrombolysis. Okay, if it is life threatening. Now for pulmonary embolism, after anticoagulation I am going with second option, third number of treatment protocol, that is third, that is thrombolytic and some surgical option or surgical therapy. Now when you will do thrombolysis, so you can do thrombolysis if you see the patient is with acute massive PE and patient is in shock, you can go for directly thrombolysis. Okay, now here you just kept in mind bleeding, if there is any contraindication is there, so bleeding screening is necessary, otherwise the patient may suffer from high risk in intracranial hemorrhage. Now you can also remove the surgical option. You have the surgery, and the surgery is known as the thrombolectomy. You can do it by the percutaneous option is there through the pulmonary vein. You can do this pulmonary embolectomy. Okay, now if the patient, next option is, if there is, you cannot give the anticoagulation drug, you cannot give these drugs, you cannot give this option, you cannot go with this option, and there is also problem with the thrombolytic surgical option, then there is another way, it is called the cable filters. In inferior vena cava you will put this filter. These filter are like this umbrella like filter, you will put it in there, and in vena cava this filter they will collect that embolism. Okay, you can only do it until if the patient cannot be gone in anticoagulation. If you use anticoagulant, then no need of this cable filter, you will know that time you use it. But you cannot give anticoagulation drug, patient is suffering from recurrent venous thromboembolism and pulmonary embolism, smaller pulmonary embolism, you should go with cable filter. Okay, so I think I have tried my best to make you give an overview of how you will go with the treatment purpose of pulmonary embolism. General management, then you must go with anticoagulation. Warfarin is there, low molecular weight heparin is there, minimum low molecular for 5 days, and total treatment should go up to 6 weeks to 6 months. For provoking causes of PE, it should be 3 months. In cancer, you can go for treatment, long term treatment. There is thrombolysis or surgical embolectomy is option also there, but you should keep in mind about the bleeding risk also. And at last, if it is not possible to give anticoagulation or thrombolysis, you can go for cable filter. In inferior vena cava, you will place the filter up to you can give that anticoagulation. If you can start anticoagulation, you have to remove these cable filters. Okay, so that's it for today. Thank you very much for listening to me.